You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. Which of the following interventions has been shown to be effective in reducing the severity of pain in cluster headaches? A. Heel drop maneuver. B. 100% oxygen at minimum 12 liters per minute. C. Hot and cold alternating applications. D. Carotid sinus massage. The answer is B. 100% oxygen at minimum 12 liters per minute. One non-pharmaceutical intervention that has shown to provide relief for a significant number of individuals with cluster headaches is 100% oxygen, delivered via mask at a minimum of 12 liters per minute. Relief can be felt in as little as 15 minutes. None of the other interventions mentioned would be likely to improve symptoms of a cluster headache. Bell's palsy is associated with infection by which of the following pathogens? A. Epstein-Barr virus. B. Herpes simplex 1. C. Herpes zoster. D. All of these are correct. The answer is D. All of these are correct. While Bell's palsy is most frequently associated with prior infection with herpes simplex 1, it may also be associated with cytomegalovirus, Epstein-Barr virus, and herpes zoster. What is the prognosis with Bell's palsy? A. Antiviral treatment is required to prevent permanent paralysis. B. Nerve resection is required to prevent corneal abrasions. C. Corticosteroid treatment is required to prevent permanent loss of taste. D. Self-resolving in 1 to 6 months. The answer is D. Self-resolving in 1 to 6 months. In the vast majority of cases, Bell's palsy resolves within 1 to 6 months without medical intervention. Moistening of the affected eye, rather than nerve resection, is required during this period to prevent corneal damage. There is very little risk of permanent paralysis or loss of taste. All of the following are common etiologies of seizure disorders except dash. A. Marijuana use. B. Genetic predisposition. C. Infection. D. Brain tumor. The answer is A. Marijuana use. The most common causes of seizures include brain injury or tumor, genetic predisposition, medications, and infections such as meningitis. While marijuana may be a trigger for sensitive individuals with seizure disorders, it has not been known to cause seizures in a non-epileptic individual and has shown to reduce seizure incidence in some individuals with this condition when used in a medical setting. All of the following medications are considered first-line treatments of absence seizures except A. Valproic acid. B. Ethosuximide. C. Lamotrigine. D. Carbamazepine. The answer is D. Carbamazepine. The most commonly prescribed medication for absence seizures is ethosuximide. Lamotrigine and valproic acid may also be used if seizures are unable to be controlled with ethosuximide. Carbamazepine, a common medication prescribed for simple and complex partial seizures, is specifically contraindicated in absence seizures. A patient is hospitalized for alcohol withdrawal and is started on medication to prevent complications from withdrawal. Which type of medication is used to attenuate the possibility of seizures during this hospitalization? A. Benzodiazepines. B. Typical antipsychotic. C. Atypical antipsychotic. D. Selective serotonin reuptake inhibitor, SSRI. E. Anti-epileptic drug, AED. The answer is A. Benzodiazepines. Benzodiazepines are the mainstay of treatment for alcohol withdrawal. Anti-epileptic drug, AEDs, are not to be used during alcohol withdrawal, and are reserved for patients who have a true seizure disorder. The Clinical Institute Withdrawal Assessment for Alcohol, CIWA, protocol is used as symptom-based therapy with benzodiazepines to prevent seizures and other complications from withdrawal. Which of the following is the first-line treatment for cauda equina syndrome? A. Surgical decompression. B. Physiotherapy. C. Chiropractic manipulation. D. Muscle relaxants. The answer is A. Surgical decompression. Cauda equina syndrome is a serious condition in which the cauda equina is disturbed within the spinal cord, generally due to impingement, trauma, local lesion, or compression. The first-line treatment is surgical decompression. Neither physiotherapy nor muscle relaxants would address the cause of this condition, and chiropractic manipulation may actually exacerbate the symptoms. A client admitted to the neurointensive care unit is having his level of responsiveness assessed by the nurse on duty. Her findings include eyes opening to verbal command, is disoriented but can converse, and obeys commands. What is this client's Glasgow Coma Scale score? A. 12. B. 16. C. 8. D. 13. E. 15. The answer is D. 13. The score of this client includes, eye open response is a 3 out of 4, best verbal response is 4 out of 5 and best motor response is 6 out of 6. An unconscious patient exhibits stiffly extended arms that are also adducted with the wrists hyperpronated. The nurse recognizes this presentation to be A. Vertebrate positioning. B. Vestibulospinal reflex. C. Crossed extensor reflex. D. Decorticate positioning. E. Babinski reflex. The answer is A. Least-rebrate positioning. Least-rebrate positioning is an involuntary response of abduction, extension, and hyperpronation of the upper extremities due to noxious stimuli. There also is hyperextension of the lower extremities and the feet are plantar flexed. Decorticate positioning involves mommy-baby posture, elbows, wrists, and fingers flexed, and legs extended and rotated medially. The Babinski reflex involves the extension of the big toe following stimulation of the sole of the foot. The crossed extensor reflex is also known as the withdrawal reflex, which involves the differential flexion and relaxation of muscles in the withdrawal of a limb. Vestibulospinal reflexes involve the use of vestibular organs and skeletal muscle to maintain balance, posture, and coordination.